This video is not medical advice. Always ask your doctor. Being a new parent is exciting, but let's face it, it's also overwhelming. There's a lot to learn, and some mistakes can actually be dangerous. In this video, we'll cover 10 things you should avoid to keep your newborn safe and healthy. Let's get right into it. If you want more calm, smart baby tips, tap that subscribe button so you don't miss a thing. Letting your baby sleep in a car seat. Outside the car. Car seats are life-saving in the car, but here's what many parents don't know. When your baby is not strapped in correctly, or is left sleeping in a car seat for long periods outside the car, it can become dangerous. Infants don't have strong neck muscles, and sleeping at a tilted angle can cause their airway to compress. This can affect your baby's breathing and overall safety. If your baby falls asleep in the car, transfer them to a crib as soon as you're home. Safety first, even if it means risking that nap. Skipping tummy time. It might seem like your newborn does nothing but sleep and cry, but even in those early weeks, tummy time is essential. When babies spend all their time on their backs, it can delay motor skills and even cause flat spots on the head. Just a few minutes a few times a day, starting from week 1, helps build neck and shoulder strength and supports brain development. Place your baby on a clean blanket, supervise them closely, and let the muscle building begin. Overheating the baby. We all want our babies to be warm and cozy, but too much warmth can actually be dangerous. Newborns can't regulate their body temperature the way adults can. Too much warmth can create unsafe sleep conditions. Pediatricians recommend avoiding overheating to reduce risks during sleep. A good rule: dress your baby in one more layer than you're wearing, and always check their neck or back, not hands or feet, to see if they're too warm. Unsafe co-sleeping. Co-sleeping is a hot topic, and while room sharing is encouraged, bed sharing, especially with soft bedding or adult mattresses, can be risky. Studies show it increases the chance of suffocation or entrapment. The safest option? Keep your baby in a bassinet or crib next to your bed, not in it. That way you're close for feeds and comfort, but your baby has their own safe sleep space. Forgetting to burp the baby. Burping might seem like a small thing, but for a tiny tummy, it makes a big difference. During feeding, babies swallow air. If that air isn't released, it can lead to gas, fussiness, and even spitting up. Some babies need to burp halfway through a feed, not just after. So take your time, try over the shoulder, on your lap, or sitting upright, and find what works for your little one. Putting pillows, blankets, or toys in the crib. It might look cute to surround your baby with soft blankets or stuffed animals, but it's not safe. Babies can't move away from obstructions, and loose items in the crib increase the risk of suffocation. The safest sleep setup? A firm mattress with a tightly fitted sheet, and that's it. Use a wearable sleep sack instead of a blanket to keep baby warm. Delaying diaper changes. Sometimes it's tempting to wait just a little longer before changing that diaper, especially if your baby finally fell asleep. But waiting too long can cause diaper rash, skin irritation, or even infections. Newborns need frequent changes every 2-3 hours, or immediately after a poop. Keep wipes, creams, and diapers ready to go. It makes a big difference for their comfort and health. Shaking the baby. Even in play or frustration. This one's serious. Shaking a baby even for a second can cause serious injury to the brain and long-term harm. It doesn't have to be violent. Even bouncing too hard or shaking in frustration can cause damage. If you ever feel overwhelmed, it's okay to place your baby safely in their crib and take a break. Walk away. Breathe. Call someone. Your baby needs you calm more than anything. Putting baby to sleep on their side or stomach. Always place your baby on their back for sleep, not their side or stomach. It might feel like they're more comfortable on their tummy, but research shows that back sleeping is safest and dramatically reduces the risk of SIDS. Once your baby can roll both ways, it's okay to let them find their own position. But until then, always back to sleep. Ignoring your instincts. You might not feel like an expert, but no one knows your baby like you do. If something feels off, a strange cry, change in feeding, or just a gut feeling, don't ignore it. Pediatricians would rather get a false alarm than miss something serious. Trust yourself. Parenting isn't just about following books, it's about learning to listen to your inner voice. You made it through the list, and that already shows how much you care. No parent is perfect, and that's okay. What matters most is being informed, present, and loving. If you found this helpful, share it with a friend, drop a comment, and don't forget to hit that like and subscribe button. You're not alone on this journey, we're here for you, every step of the way.